Women often pride themselves in being able to get it all done, and one thing that often falls by the wayside is their own health. But that, in reality, should be priority number one. Corey Atkins and Michelle Dunaway have this month's MedWatch report on the importance of women's heart health.
You do value life a little bit more. You think about it, again, it goes back to thinking about things you would have missed. And I didn't want to miss watching my kids grow up.
Thankfully, Cynthia Watkins got to see her sons grow up, got to know her grandchildren, and got many more years of life after a real scare when she was in her early 40s. She was out of breath, falling asleep in meetings, and assuming this was all something else.
I was having this discomfort in my chest, but I thought it was like heartburn or something like that, and I was taking Tums, and my friend Barb at work, her and she'd bring me Tums, or I would bring Tums in, and I would just keep taking them. Because it made me feel better.
But they weren't making her better, and she ended up in the hospital.
When they got in there, I had 85% blockage in the LAD, so which they call a widowmaker, because a lot of times people don't have symptoms from what I understand, or don't pay attention to those symptoms.
She never had an actual heart attack, but this was scare enough.
I remember thinking, I don't want someone else taking care of my kids. But because they were 8 and 12, so I need to make changes.
I think women tend to put off their symptoms. They're often the caretakers in the family, and so a lot of times we'll dismiss the symptoms that they have and not draw attention to the fact that they are having either decreased exercise tolerance or overall fatigue. They might just think that that's a sign of their stressful life that they're in.
Munson Medical Center cardiologist Anna Stone says for women and heart health, knowledge is power.
Women definitely need to go and get routine evaluations from their physicians. Being able to know your numbers with your blood pressure, your cholesterol, your weight is really important. If your dad had a heart attack before age 55, or if your mom had disease before age 65, knowing that you're at increased risk is very important.
Something else all women should know, how their lifestyle affects their heart.
Having high cholesterol, being diabetic, being overweight, having a family history of early coronary disease, as well as being a tobacco user, are all risk factors for coronary disease for women.
And while coronary artery symptoms can often be chest pain and pressure, sometimes women feel other things as well.
It can either go to the jaw, to the back, between the shoulder blades. They can feel just anxiety, or they can feel palpitations. Overall, they can also just feel a general decline in exercise tolerance as well.
Cindy said her pain was very specific.
Just this rubber band effect. And like I said, it felt like a wide rubber band just tightening up around my chest.
And today, she has 2 messages to share. One is to know your family history. The second came from the nurse who treated her when she was hospitalized so many years ago.
You need to make your doctors aware of those fears or feelings that you're having so that they can evaluate you.
For MedWatch, I'm Michelle Dunaway.